We want to turn now to Dr. Rochelle Walensky, who's the director of the CDC. Dr. Walensky, good morning. It's good to see you.
Good morning, Savannah. Thanks for having me back.
We love to see that the cases and the hospitalizations are on the way down, deaths as well. But the vaccination rate has slowed significantly from its peak. We're at about 500,000 shots a day. At that current pace, would we hit the president's goal of 70% with all adults with at least one shot by July 4th?
We have had days in the last, month where we've been over 4 million shots a day. We're now at 500,000 coming off of a long holiday weekend where people might not have been focusing on getting their vaccine. And that's really what the push for June is moving forward. And that is to understand all of the reasons why people might not have yet rolled up their sleeves and meet them where they are, whether it's access, as you noted, or whether it's they need more information, more understanding, whether it's they want to get it at work or they haven't had time off, they haven't had a ride. So we're doing all that we can to not just boost those numbers, but to reach this goal.
Yeah, but if everything stays the same, would you get there, or do you really need to do this push to try to reach that goal?
I think that, any singular day's counts of how many vaccines we're doing is not necessarily reflective. We've launched this push now. We anticipate that we will be able to reach more and more people. And I would say every shot in every arm is a win because that person is now safe and protected from getting COVID-19.
So what is the plan to get folks off the sidelines? Because, in the beginning it was people racing and trying to get those appointments. Now you have the harder ones to get. So I always say the last mile is the hardest mile here. So how do you convince the vaccine skeptics or those who are just maybe wait-and-seers?
I think that really speaks to the diversity of effort in the next month ahead. And part of that is, was it that you needed a ride? So we have Uber and Lyft helping. Was it that you didn't have access in your 2 shifts a day of work? We have places where people are meeting you at 4 a.m. at your change of shift to get vaccinated. Is it that you wanted to talk it over with your friends at the barbershop? We're doing it in barbershops. What is it that that would lead you to get vaccinated? And then really the other question is, if it's not about access, if it's not about community, then is it about, you really want to understand the science better. You really want to understand more about how we got 3 safe and effective vaccines so quickly. We're there to help you as well. So, where people are is they have individual questions, individual issues, and we're really spending the month of June addressing all of those in all walks of life, from celebrities and athletes to businesses.
What is the significance, Doctor, of the 70%, one shot in every adult, 70% by July 4th? Is that purely a political deadline, or is there a public health threshold you're trying to reach, whether you call it herd immunity or not?
We know that the more and more people who get 1 vaccine and then 2 get fully vaccinated, the more we as a nation are protected. We know that the vaccine not only protects individuals, it protects communities, it protects their families. And so the more people who get vaccinated, as we all have talked about, there is no magic target for the herd immunity, but we believe that getting to 70% would go an extraordinarily long way to making sure that we have community protection. The other thing to really note is something you raised early on, which is we're not uniformly at 70%. We have pockets of this country that have lower rates of vaccination. I worry that this virus is an opportunist and that where we have low rates of vaccination are where we may see it again. And so really the issue now is to make sure we get to those communities as well.
And quickly before I let you go, summer camp. We always got to talk about summer camp. There were new guidelines released by the CDC that seem to suggest unvaccinated kids under 12 generally don't have to wear a mask if they're at camp and they're playing outdoors. Did I get that right?
You got that right. The caveat that I would say to that is let's look at how much disease is going on in the community. If you have a lot of community spread going on in the counties and communities around you, then I would say if you're going to be in crowded places outdoors, if there's a crowded concert or a crowded singing event, you may want to consider putting on the mask. But for the most part, outdoor activities for young kids in lower risk communities, enjoy camp.
All right. Thank you very much, CDC Director Rochelle Walensky. Appreciate your time this morning.
Thanks so much, Savannah.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.